Hi, Ale. Good afternoon.
Good afternoon, teacher. How are you?
Fine, thank you. Waiting for your classmates. So let's just take a minute, okay? And we are going to start.
It's okay.
How is everything? How are you?
Fine, it's everything okay here.
Okay, that's so good. Who is with us? Oh, Lily, how are you? Okay, she's connecting.
Good afternoon, teacher. Hi,
Good afternoon, Lily. How is everything? Do you listen to me?
very good, teacher. I am listened. You?
Okay, thank you. I think we're gonna start, okay?
Okay, teacher.
Oh, just in time. Okay, hi Belen.
Hi, Miss. Hi, Miss. Hi, everyone.
Okay, that's so good. Okay, let's start then. Well, this unit, it's called investigations. I know you know and you are so related to these themes on topics, so I just want you please to read this part. Ale, can you do it, please?
Yes, miss. An ophthalmoscope allows the doctor to examine all parts of the eye: the iris, lens, retina, and optic disc for best results. The examination is done with dimmed or lowered lights to allow the pupil to maximally dilate or widen. A topical mydriatic solution may be applied to the eye to aid dilation. The patient is then asked to fixate on a target for the duration of the test.
Okay, thank you very much. So as you can see, we have just little things about ophthalmoscopy. I don't know if you want to add something that maybe it's new for every one of us, or if you have some doubts about vocabulary. Of course, this is an specialization, right? So maybe most of you didn't work with this kind of things, but if you know something or you know an ophthalmologist, maybe you can add something. Is there any question here?
Miss, what is the meaning of dimmed?
Dimmed. Dimmed means atenuado. So it can be atenuado, bajo, cuando las luces permiten que la pupila se dilate a lo máximo.
Okay, Miss, thank you.
No problem. Maybe, do you understand the word widen?
It's the opposite of delayed, dilated, yes.
Dilated. Yes,
Let's see, it's the opposite.
yes. It's okay. It's the opposite. But do you remember the word wife? Like the song with artist
It
white.
is, como que ancho.
Yeah, yeah. Widen, it's like ensanchado. Okay. Is understood here?
Yes, teacher.
Okay. That's so good. Then we have the blood pressure. Belen, can you read this part for us?
Okay. A stethoscope is used to hear the sound of blood rushing back through the artery. The first thumping sound is the systolic blood pressure, SBP. When the thumping sound is no longer here, that's the diastolic blood pressure, DBP.
Okay, thank you very much. So we have the parts of a blood pressure or sphygmomanometer, right? And stethoscope, sorry. Okay, a sphygmomanometer, but it will be almost the same in Spanish, right? We have the gauge, the cuff, the valve, and the pump, okay? And on the other side, we have the stethoscope, the earpieces, the headpiece, the bell, and the diaphragm, okay? So I don't know if you want to add something or if you have some questions here.
What means thumping?
Pumping. The meaning would be, or the translation that you will find will be descomunal, okay? But in this case, when the thumping sound is no longer heard, it's almost like la resonancia, ¿no? El sonido que inmediatamente ustedes escuchan al poner el estetoscopio en sus oídos. Son como golpeteos, ¿no es cierto? Palpitaciones. Pero la traducción es descomunal.
Thanks, teacher.
No problem. And if you have another meaning of this word, please share with us. Maybe you have another dictionary. It's important that you can write down these words: systolic blood pressure, or SBP, and diastolic blood pressure, or DBP, because I know someday you will use it, or you will find on maybe an article or something like that. Okay. Is there any questions here, or you want to add something else?
No, miss, it's fine.
No, miss.
Okay,
No, teacher.
perfect. Then we have the taking blood. I know, or I don't know, maybe if everyone did this practice sometime. Did you do it?
Yes, miss.
Well, let me make congratulations to you because I couldn't do it. Just I tried once and it was a little bit hard for me to do it. I don't know why. Maybe watching the blood or but it's so funny because I work watching blood every day, so I don't know why, but I felt sick. Can you imagine that? Okay. Lily, can you read this, please?
Taking blood. During venipuncture, the phlebotomist, a technician who takes blood, inserts a needle into a vein and withdraws blood into a specimen tube, which is sent to the hematology laboratory for analysis. Usually, the phlebotomist can find a vein in the inner part of the elbow, the antecubital fossa, that is easily accessible. She may apply a tourniquet, a thin band about the site, or the patient may be asked to clean their hand to make a fit. In lady undressing, usually a piece of gauze to help the blood to flow and to prevent swelling and hematoma. A black and blue mark or bruise where the vein was punctured. Note, a bruise is a specific mark. Bruising can be used to describe a number of bruises or a larger area. The patient exhibited bruising on the right forearm.
Forearm. It's okay. Thank you, Lily. Okay, so here we have the procedure for taking blood pressure. Do you have any questions of vocabulary? For example, withdraws means taking blood. It might be almost a synonym, but it means in Spanish, retirar. Okay, so what else? Do you understand the expression can find a vein in the inner part of the elbow?
Yes.
Okay. What about Ale and Lily?
Yes, teacher.
Yes, miss.
Perfect. Then what else? Any other question?
A tight band means a widened band. It's similar.
Where is it, please, Lily?
Follow tourniquet, a tight band.
She may apply a tourniquet, a tight band. And you said it was almost like
Similar a widened, o sea, como ensanchado, una banda ancha, tight,
no,
or no?
no. A tight band means the cordon of, I don't know of what material it's made of, but you put around the arm to make a tourniquet. Okay, and it's plastic. Remember? Do you remember that? They tied
Yes.
that band.
Algo para lo que aprieta.
Exactly. Es la banda.
Sometimes the nurse using the gloves.
Yeah, it's that. It's just like that. And we have another word here, clench. Do you understand that?
I think it's like when you tell the patient to squeeze his hand to help the blood comes out, right? I think
Yeah,
that it's like that.
yeah, it's exactly that. And we have another word, to make a fist. Do you understand the first word? It's just like that.
It is exact.
Okay, try to explain to me, Lily.
You say that
Uh-oh.
it is make a fish, puño.
Yeah, okay, that's correct. When you put your fingers together to make a fist, okay? That's correct. Then what else? Do you have any other questions here? And is it correct, the procedure here, or do you think you can add something or you can take off something? In your experience?
I think that the asepsia can be first. First of all, it's that.
Okay, that's correct. And maybe nowadays it's more important, right? So that's a good observation. If you have any other question, just tell me, okay? Or we can continue.
Yes, Miss.
Okay. What about Lily and Ale?
Miss,
Yeah,
what cloth miss mean?
clot.
Yes.
It's when the blood forms almost a crust. Before to form a crust, it appears a clot. Do you understand?
Mm,
Okay,
I did.
okay, but it's um, an an appearance of the blood when it gets dry. Okay, it will form a clot. Then it will form a crust. Es un coágulo.
Thanks.
No problem. Any other question? Can we continue, Ale?
Yes, Miss.
Okay. Okay, so we have here a laboratory test, and you can find some boxes that you will fill if you need to take these kind of tests of your patient, right? What are the most common ones? In your experience? First of all, do you, okay. MSU means midstream specimen of urine. CSU means catheter specimen of urine. NP secretions, I don't have so much idea of that, but maybe some kind of infections, I think. I don't know if you can, if you have the answer for that.
It's not nasopharyngeal secretions.
Okay, it might be. I couldn't find that. So, thank you, Belen. And BAL, bronchoalveolar lavage. Okay, so which one do you usually use to ask for tests with for your patients?
Urine, that it's common, just the urine, the other specified, that one, I think. The feces, the blood culture, I think that it's like a hemogramma, right?
Yeah.
That right. And yes, it depends. If you suspect of a patient that has AIDS, you can ask for a EDTA blood, or maybe to see the hearing for chlamydia, like it says, or maybe if he has another disease like in her lungs or in his lungs, like COVID, I don't know, you can ask to discard the nasopharyngeal secretions, the BAL that induces sputum. It depends, I think.
Okay. Okay, thank you, Belen. And I don't know, Lily, in your experience, do you work with laboratory tests or not so much?
Yes, teacher. I think the most common are urine, faces, sputum, lavado bronchoalveolar. It's not common. Induce sputum, not common. What's mean SW?
SW in virus TM, I found Starch-Weber syndrome, but I'm not sure about that. So it would be a good help if you can find it for the next class, and we can discuss about that. If we are stays with this definition, or maybe make some changes.
Okay, teacher.
Okay, so I will say it again. Starch Weber syndrome. Okay. Then we have CSF, that it will be cerebral spinal fluid. Okay. Ale, do you have any other question or you want to add something?
No, miss.
Okay. So let's continue then. And we have here, just to watch, a biochemistry and hematology lab report, right? And I think this is the most important part for you guys, because you work with results, right? The laboratory part is just for the biochemistry and hematologists, right? But here you will know if your results are on the range, or are low, or maybe are high. And then you will get into a diagnosis, right? And then we have terms. Belen, can you read this part, please?
Okay. Up, high, elevated, raised, when the results are within the normal range, doctors say. Down, low, reduced, potassium within normal limits, normal, unremarkable. Unit abbreviation. GL, I don't know how to say it in, in English, the gramos.
Yes, it's okay. The unit abbreviation is G over L, right?
Okay. Grams per liter. The can I read just the thing?
Yeah,
Like,
yeah.
okay. Liters per liter times 10 to the power 9 per liter, femtoliters, millimoles per liter, micromoles per liter, units per liter.
Okay, thank you, Belen. Okay, yes, it's not so much important, this part, but the part that we really have to know is how to read the results, right? We have to know the range, and that's the most important part. For example, when we know that it's elevated, we call that or up or high or raised. When we know that it's reduced, we can call that name or low or down, maybe to explain to our patients. Okay. And we have the endoscopy. Belen, can you read again this part?
Okay. Functions of endoscopy. Endoscopy is a way of examining parts of the body which are not visible from the outside. A typical endoscope is a flexible tube which is inserted through one of the natural orifices, openings such as the anus or mouth. Rigid endoscopes, which cannot be lent, several channels to transmit light from the outside and images from inside, and to allow different instruments to be used to provide diagnostic information, to excise, cut out diseased tissue or growths such as polyps, to clear obstructions, to take a biopsy, to cauterize a site of bleeding by applying heat.
Okay, thank you, Belen. We have functions, not functions, okay? And I don't know, but this procedure seems to be so hard. I don't know. What do you think, guys? I want you to listen to you. Did you have the chance to participate in some of this procedure? Maybe Lily?
Yes, the teacher. Sometimes I thought to do the procedure, but I don't. Um, I don't do this procedure.
Okay, you watch do this procedure, right?
Teacher.
Okay, and what do you think about it? It's almost the same procedure that here is described or not?
Yes, teacher. I think the description it's like generally the endoscopist perform this procedure.
Okay, thank you, Lily. I don't know, Belen, if you had the chance, or Ali maybe, to solve these kind of procedures while you were making your internship, maybe?
No, miss, I didn't see.
But you know how to do it? Did you had the chance to read about it?
Yes, yes.
Okay, so you are agree with this description, or do you think it is missing something?
I agree with the description.
Okay, thank you. And Ale, what about you?
Yes, Miss, I agree with the description too.
Okay,
I
but
didn't see the procedure.
okay, you didn't see it yet. Perfect. So I think you don't have any questions here of vocabulary, right?
Right, miss.
Perfect. And again, Lily, can you read this part, please?
Enteroscopy. Now I'm just lubricating the tube with a jelly which contains a local anesthetic. It will help to ensure a smooth passage as it passes down and you shouldn't feel too much. I'm going to feed the tube through your nose. This is most uncomfortable part of the procedure, but it's very brief. You'll get used to the tube in a few minutes time. Okay, when it hits the back of your throat, take a deliberate swallow. I'll take you went. Now, swallowed. That is, well done.
Okay, thank you, Lily. I didn't know you were here, Vanya. How are you? So, I'm sorry. I didn't know that you were here. But I want to know if you have any questions still here, or if you want to add something.
No, miss, it's okay.
Okay. Did you understand this part of enteroscopy?
Yes, miss.
Okay. So I have a little question for you. For you guys. Which is the difference between enteroscopy and endoscopy?
when I performed the endoscopy, it's trying, looking the upper digestive, no sé, la vía digestiva superior.
Yeah, the upper
And
digestive
upper digestive.
system.
And
Yeah.
enteroscopy, I watched the lower.
Okay, that's a good
digestive.
description. Thank you, Lily. Thank you so much. Okay, so I don't know if you have something to add or another way to describe these differences or some doubts about the vocabulary here.
Yes, Miss. Endoscopy is a general procediment.
Mhm.
Enteroscopy is a directioner on the upper digestive vía digestiva, como dijo.
Yeah, procedure, upper
Procedure.
digestive procedure.
We have to colonoscopy and the
Yeah.
down digestive down.
Okay, thank you, Vania. It's even more clear now. I don't know, Ale and Belen, if you want to add something.
No, Miss, it's fine.
Okay. Ale, what about you?
Teacher, what does swallow means?
Swallow. When you are eating something, for example, you chew, right? You're chewing, and then you have to swallow what you're eating. Do you understand now?
Yes, miss, I get it.
Can you say it in Spanish, please?
Es como tragar.
Yeah, that's the word. Continue then. Oh, what happened with my... Oh. Okay, Vania, can you read this part, please?
Report of diagnostic endoscopy. Examination. Informed consent was obtained from the patient after discussing risks and benefits of the procedure. The patient was connected to the pulse oximeter and placed in the left lateral position. Oxygen was provided through a nasal cannula, and the premedication administered as stated. The endoscopy was introduced into the esophagus. At the end of the examination, the patient was transferred to the recovery area to recuperate.
Okay. Thank you very much. I don't know if you have any questions here about vocabulary, because I think you know how to use a pulse oximeter, right? Maybe in the more even in this time, right? With COVID, I think everyone wants or has an oximeter at her house or at his house, right?
Right.
Do you have any questions about the vocabulary?
No, teacher.
Okay. Okay. What about Vania and Belen?
No, Miss.
teacher.
Perfect. Let's continue then. We have the X-ray and CT, radiography and radiology. Okay, I will read it, this part. Radiography involves exposing part of the body to a small dose of radiation to produce an image of the internal organs. Organs with high density, such as the ribs and spine, are radiopaque, meaning they do not absorb radiation and appear white or light gray on the image. Lung tissue is radiolucent, absorbs radiation, and appears dark on the image. Before some types of Earth's rays, patients are given a liquid called a contrast medium, such as barium or iodine, which is radiopaque and allows the organ or tissue it feels to be examined. The contrast medium may be swallowed, introduced through the anus as an enema, or given as an injection. Radiology is the use of radiation in the diagnosis and treatment of diseases such as cancer. So, are you agree with these descriptions?
Yes, Miss.
Yes, Miss.
Perfect. Do you have any questions of
Yes, teacher.
vocabulary? Thank you, Lily.
No, Miss.
Perfect. Okay, I have one question for tomorrow. I will ask you tomorrow then. Okay, Ali, can you read this part, please? This side, the right side.
Yes, Miss. X-ray examination. The chest X-ray is the commonest diagnosis X-ray examination. Normally, a frontal anteroposterior view is obtained. The patient stands facing the photographic plate with the chest pressed to the plate, with hands on hips and elbows pushed out in front. The radiographer, the technician who takes the X-ray, asks the patient not to move, then to breathe in deeply and not to breathe out. This makes a blurred, unclear X-ray image less likely and improves the quality of the image, as it is easier to see abnormalities in air, filled, inflated lungs than deflated lungs.
Okay, thank you. And Lily, can you read this part, please, on the right side?
For a side or lateral view, the patient is asked to stand sideways to the photographic plate with arms raised. A chest X-ray may be repeated at intervals to track for any changes. These repeated examinations are called serial chest X-ray.
Okay, thank you. So it's most like a description of the examination, right? I don't know if you had the chance to help maybe the radiologists, or you saw how they prepared your patients for the X-ray test, or you have any experience about that? Maybe Vania or Lily, in your experience?
I don't have any experience with the take X-ray. I just ordered this test, but I don't.
You don't have to do it.
I don't. Exactly.
Okay, Lily, thank you. Well, how lucky you are, because in my case, in a case of dentists, maybe, we have to do it in our consultation, or we have the chance to send to another center to make the x-ray. But if you have the machine, you have to do it on your consultation. And it's a little bit dangerous for us, right? Especially for women. So we have to be really careful about the procedure, because we can have some problems in the future. But I don't know if you are agree with this description of examination.
Yes, Miss.
I have a funny experiences.
Please tell us.
When people, when patients they, with her clothes or with their clothes, and in their clothes there are some devices with the metal in the x-rays by the densities is in the placa, or say,
Plate.
like when you say
In this case, plate.
Plate, the plate, the plate in the thorax. These images are very resultant. And it's very important, the
Yeah.
technician of X-rays. It's, yes, they are very experimented on this aspect.
Yeah. And to ask the patient, right?
Yes, they they should explain the patients how is the procediment and the
Procedure.
dressing for this procedure.
That's right. Very good, Vania. That's so common, right? If the technician is not experimented, as you said, maybe some people can appear in the X-rays with their rings or earrings, right? And that's something a little bit. I don't know if it's dangerous, but it's not helpful for the doctor, because they won't see what is happening, or what you want to see, right? And on the other hand, the technician has to take another plate, and I know, and we know that here it's a little bit expensive to take x-rays, right? So thank you for
Yes,
sharing.
yes. Sometimes we have a patient with a cell phone in the place in the
Oh,
hair. It's,
and where exactly this phone appears?
in the heart.
Oh my
Yes,
God.
in a long left. Yes.
Okay. So yeah, it's funny, but I think it's not helpful, right? So we have to be really careful about that. Thank you, Vanya, for sharing with us your experience. Okay, I don't know if you have any questions here for vocabulary, Larry.
In the third line, when the The patient stands fastened. What means exactly stands fastened?
Okay, when you find this kind of expressions, stands facting the photography plate with the chest pressed to the plate, it's almost like you were against the plate. Okay, so maybe you are not moving and you're against this plate, just awaiting for the X-ray to appear. Is it understood? Lily?
In Spanish, please, teacher. I don't
Okay,
understand.
facting the photographic plate in Spanish means haciendo la placa fotográfica. But in this case, it's almost like you stand, you don't move, and you're against the plate, okay, or waiting for the X-ray to come. Es como que estuvieras haciendo la placa, pero estás esperando por eso, está esperando para hacer la placa. Más o menos es una expresión así.
Thanks, teacher.
You're welcome. Any other question here?
No, miss.
Okay, Belen, thank you. How about the other three? Perfect. Can we continue then?
Yes, miss.
Okay, thank you, Vania.
Yes, teacher.
Thank you, Lily. And we have the computed tomography. Can you read it, please, Belen?
Okay. Here is an extract from a hospital's press release. The Western General has installed a new GE Lightspeed 16 computed tomography CT scanner. CT uses an X-ray source which rotates around the body to produce cross-sectional images. The new scanner takes up to 16 simultaneous cross-sectional images slices and transmits more data in less time than ever before. Each slice can be less than 1 millimeter thick, making it possible to find very small abnormalities. The scanner will be used for diagnosing muscle and bone disorders, locating tumors, infection, and clots, monitoring the progress of malignant diseases, and the response to therapy treatment, providing accurate guidance for interventional procedures such as biopsies and drainage, removing fluid from the site of an injury or infection.
Okay, Belen, thank you very much. So, do you have any questions for vocabulary? Do you remember what was a clot or clots?
It was, I can say in the Spanish or in English.
Try to explain in English, please.
It's the thing that the most of the women has in their ovaries.
Okay.
That could be an explanation. I don't know how to say it.
Could be. Okay, yeah, you can say it in Spanish.
Son quistes, right?
No,
No? Okay.
no. We already seen this in 4 or 5 slides before. Who remembers that? Ale asked about that. Maybe when you get injured, you had an accident, okay? You had an accident and you have some bruises on your head. The people, sorry, doctors usually do a CT, right? A CT scanner, just to watch if they have some clots in their heads causing by the accident. Because with the time, these people can even die because of these clots. And sometimes these clots reabsorbed. Do you understand what am I talking about?
Yes, Miss. Now,
Yes.
yeah.
It
What?
was a coágulo.
Yeah, that's right. Yeah, I know you. We have memory, a bad memory, right? So we have to practice every time. Okay. Okay, guys. I don't know if you have any other question here from vocabulary.
No, Miss.
Okay, Belén. What about Lily, Vania, or Ale? Do you have any questions here?
No, teacher.
Perfect.
No, Miss.
And Vania, do you have any questions? Thank you,
Miss,
Ale.
drainage is same of drenaje.
Drainage. It's removing fluid from the site of an injury or infection. Yes, it is. But remember this definition. Removing fluid from the site of an injury or infection. Es un drenaje. Do you understand the expression accurate guidance here?
Yes, Miss.
Yes, Miss.
Okay.
Yes, teacher.
Okay, Vania, do you understand this expression?
Yes, Miss.
Okay, perfect. So let's continue. We almost finished. And we have this part. Vania, can you read this part, please?
MRI and ultrasound, magnetic resonance imaging is safer than X-rays because it does not use radiation. It provides more information than computed tomography about some head, neck, and spinal disorders because the images are more detailed and have more contrast, meaning the difference between dark and light areas are stronger. Unlike CT, the images can be taken on any plane, any surface of the body, seen from an angle. It is now used for taking images of the brain and heart and in oncology.
Thank you, Vania. Thank you
Okay.
so much. I'm so sorry. I will kill here the class because we are over time. Okay, thank you so much. We're going to stop here to next class, okay? And I will ask you, please, to fill this questionnaire.
Miss, I have a question.
Yes.
Are we going to take a final test at the
Yes.
end?
Yes, you're gonna take a final test at the end, but it's not something from other world. Okay, don't worry. It's about the things you already knew in Spanish, the things you might do on your consultations or about what we have been learning. Okay, so don't worry about that. It's why am I sending those practices? Did you finish your practices? Yes?
Yes, Miss.
Okay. So I think you won't have any problem then. Okay?
Okay, but
Okay.
we have to speak in the test or write or
No, just write. Just
uh,
write. I'm evaluating you every time, especially in the speaking classes, right? I know that you are getting better. If you don't know, if you're getting worse, but in your case, it's not like that. You're getting better. So it's better if you just come into the speaking classes. If you can make it into the theoretical classes, I know, I understand, but you have to come to the speaking classes. It will help you a lot, okay?
yes, Miss, thanks.
Okay, guys, thank you very much. I don't know who's gonna be first for tomorrow. I'm so sorry. Almost forgot that.
Miss, could be the last, please.
Yeah, of course. Okay, Vania, you're the last one. 6:45.
Well,
Thank you.
I want to be the second, please, Miss. Would
Okay.
be the third, please.
Okay, Lily. And Ale, you're gonna be the first one.
Yes, Miss.
Yes. Okay. Thank you, guys. Thank you so much for your time and your patience. See you tomorrow then. Okay? Take care.
Bye-bye.